The mission of Craig Hospital is to assist patients return to a full, active, and healthy lifestyle in all areas. It can be unbelievable the changes to your body that have resulted from the spinal cord injury. As a new patient to Craig Hospital, you will be introduced to new care routines that will be part of your daily life for some time. Research has shown that skin sores are the most common secondary complication of spinal cord injury, with associated decreased quality of life and poor life satisfaction and substantial economic burden resulting. This education video is intended to help you and those who assist with your care learn how to prevent skin sores. The more you know about this potential problem, the better able you will be to participate in your daily care and decisions about your care. Before a spinal cord injury, you were able to move freely and change positions when uncomfortable. Now, because your spinal cord injury has decreased the ability to feel and move, you may not know when a position change is needed to prevent the development of a skin sore. There are many changes in skin function after spinal cord injury, thus making people with an SCI more prone to skin sores. Skin is the largest organ of the body. Like any good covering, skin protects its contents, muscles, organs, and bones from the outside elements. The development of a skin sore makes a person more prone to infection and illness. Skin also gives us our body shape and contour, our form. Skin allows us to make contact with others in our world through touch. Human skin also helps keep the body temperature regulated. Sweating helps cool us off and disperses heat. The skin also keeps us warm by holding body heat and warmth in. Many times, these functions are disrupted after a spinal cord injury. These changes make it very important to proactively protect yourself from frostbite, sunburn, and overheating. Current research has discovered there are other risk factors too. Some cannot be avoided, like being male, having spasticity, or having a complete spinal cord injury that was caused by a violent incident or the natural aging process. Other risk factors involve personal choice, such as cigarette smoking, healthy body weight, and avoiding pneumonia and other respiratory illnesses through good lung hygiene, coughing, deep breathing, and washing your hands often. Also, since a healed skin sore is never as strong as it used to be, once a sore develops, there will always be an increased risk of developing another one. In a perfect world, all skin sores would be avoided completely, but even when everything is done perfectly, skin sores may still develop. Which is why it is so important to learn how to protect yourself from skin sores, and if one develops, how to identify the cause and how to care for it to prevent it from getting worse. In the medical and nursing fields, skin sores have many different names, but all refer to the same thing. A skin sore, sometimes called a lesion, wound, or injury, is basically damaged skin and is often caused by unrelieved pressure that results in breakdown of underlying tissue. Factors other than pressure can also contribute to the development of a pressure sore. These include friction or shearing and moisture from excessive perspiration or incontinence. Skin sores usually occur over bony prominences, places in the body where the bones are closer to the surface and do not have much natural padding or protection. Because people with spinal cord injury have both impaired mobility and sensation, they spend a good deal of time either sitting in a wheelchair or reclining in bed. These positions put continuous pressure on the same areas of the body throughout the day and into the night, requiring special skincare routines to decrease skin sore development. These care routines include turning in bed at regular times, padding of body areas, special mattresses, routine skin inspections, weight shifts while up in a wheelchair, shoes that are 2 sizes bigger than usual, a timer for weight shifts every 15 to 30 minutes, and special seat cushions in wheelchairs. When lying in bed, pressure is distributed over a greater area than when sitting up. When lying in bed on the back, the sacrum coccyx or tailbone and the heels are most vulnerable. For very thin people, shoulder blades may also be at risk and will need extra protection. When lying on the side, the hip bone or trochanter is the most vulnerable, as well as the knees and ankle, especially if they're touching. When sitting up in a wheelchair or on any other type of chair, the sitting bones or ischials are at the greatest risk. If there are problems with curvature of the spine or difficulty sitting up straight due to the injury, The more pressure will be put on one side of the buttocks than on the other side and could cause a sore. A properly fitted wheelchair, cushion, and back seating system will help with sitting position and posture so that pressure is evenly distributed. It is important to understand that skin sores generally do not start on the top of the skin where you can see them. Instead, they begin deep inside the body and work their way up from the bone to the surface of the skin. That inside-out process makes it hard to find a sore early in its development. By the time the skin is showing a sore, through color change or with an open area, the tissue beneath it is already damaged. It is important to learn how to prevent sores from happening and how to know the signs of a sore for early detection. Skin sores are classified as stage 1, 2, 3, or 4, suspected deep tissue injury, and unstageable based upon the degree of the tissue damage observed. The classifications are based upon which layer of skin and tissue are damaged and how severe the damage is. All healthcare providers use these classifications to describe skin sores, so it's important to become familiar with these terms. Stage 1. This stage is considered mild and has the least amount of long-term damage. Because the skin is intact, it may not be thought of as a skin sore in the usual sense. However, if ignored, there is potential for further breakdown. Some warning signs are important to identify when a skin sore is developing. These warning signs are: the skin is warmer or cooler to the touch. The tissue feels firmer or boggy or mushy as a result of fluid buildup under the skin called edema. The area may hurt or itch. The skin may be a different color, pink or red in light skin, red, blue, or purple in darker skin. Frequent skin checks will help you recognize what normal skin is for you and to ensure that skin sores are caught early. When any pink, red, or discolored area of the skin is noticed, blanching or touching the skin to check for circulation must be done. If the discolored area blanches or turns white before returning to the discoloration, this means there is still circulation to the area. If the discolored area does not blanch, it means circulation has been damaged. In both cases, pressure must be relieved to prevent further damage. Once the skin returns to normal color, you may return to normal activity again. Stage 2 sores are a shallow open ulcer with a pink or red wound bed that is either dry or shiny. It may also present as an intact or ruptured blister. If you discover any open skin sore, you must have the sore assessed by your medical team. You and your doctor will design a plan for healing, but until then, you need to stay off the sore completely. Stage 3. A skin sore at this stage is considered severe. The damage extends through all layers of the skin, through the subcutaneous fatty tissue to the muscle. This ulcer looks like a deep crater with damage to the surrounding areas. Subcutaneous fat may be visible, but bone, tendon, and muscle are not exposed. Slough, yellow, tan, gray, green, or brown discharge may be present, but does not obscure the depth of the tissue loss. The wound may include undermining and tunneling. Undermining and tunneling is when there are tunnels and deep craters under the skin that are not apparent on the surface. Sort of like a gold mine that has one opening in the side of a mountain, but with several tunnels and paths deep inside. The depth of a stage 3 skin sore varies by anatomical location. The bridge of the nose, ear, back of the head, and heel do not have subcutaneous fatty tissue, and stage 3 sores can be shallow, in weeks or months, and will require collaboration with your medical team. The person with a stage 3 skin sore may be required to stay off the area, which could mean several weeks of bed rest and immobilization. A healed skin sore is never quite as strong and stable as skin never broken, and will always require close and diligent monitoring. Stage 4. This is the most severe and serious stage of skin breakdown, with the deepest levels of damage. In stage 4, the sore extends all the way from the surface of the skin to involve the muscle and bone, and may extend to bones, joints, and tendons. Eschar, tan, brown, or black discharge may be present on some parts of the wound bed. Also, as in stage 3, slough may be present and will usually include undermining and tunneling. Because stage 4 sores extend into the muscle and supporting structures, like tendons, joints, and bones, osteomyelitis is a probable complication. This is a very serious infection in the bone that can require long courses of antibiotics and possible surgery to resolve. Additionally, surgery is often required to assist in closing and healing of the stage 4 sore. If surgery is required, complete bed rest and immobilization will be required for approximately 5 weeks. Occasionally, the sore is classified as unstageable or suspected deep tissue injury because the wound bed is not visible. This is usually the case when the sore is covered by slough, eschar, or with a scab. Suspected deep tissue injury is usually a purple or maroon localized area of discolored intact skin or blood-filled blister due to the damage of underlying soft tissue from pressure or shear. It may begin as a thin blister over a dark wound bed and further evolve to be covered by thin eschar. These wounds can deteriorate rapidly, exposing additional layers of tissue even with optimal treatment. They must be taken very seriously. Until the base of the sore is revealed, with help from your medical team, the true depth and therefore stage cannot be determined. Keep pressure off the area and contact your healthcare professional for assessment and consultation.
Since I've been admitted to Craig, I've learned that it's really important to pad yourself at night, to do your weight shifts on time every time, and pretty much get your chair fitted to your body so that it's better for your body. Your skin is your most important boundary on your body, so it's good to protect that.
People with a new spinal cord injury are usually started on a schedule of turning every 2 hours. This routine allows your skin to be relieved of pressure on the bony prominences and allows circulation to return to those areas. Eventually, your skin will get more tolerant and you will be able to sleep longer before being turned at night. If no skin problems develop between your turn times, your turns will be advanced by 30 minutes over several weeks. The goal is to advance your turns to about every 6 hours before you go home. Shifting your weight while up in the wheelchair is another way of changing positions to prevent skin breakdown. There are several different ways of performing weight shifts while up in a wheelchair, and your occupational and physical therapist will assist you in learning the best and safest way for you. A weight shift is done about every 15 to 30 minutes. A timer will be useful at the beginning to remind you to do the weight shifts. The type of weight shift performed will depend on your wheelchair and cushion as well as the condition of your skin. Inspecting your skin at least twice every day is another way of practicing good skin care. Use your eyes and hands to check your skin carefully. Skin inspections are done at least once in the morning and once at night, usually when the skin is exposed and easily visible. Pay special attention to common sites of pressure sores. For example, when getting out of your wheelchair at night, check the sitting bones and back. When getting up in the morning, check the back, shoulders, hips, and heels. Your nurse will provide a long handle, flexible head mirror for those hard to reach areas. It is your responsibility that skin inspections be completed regularly, and if you need help, ask caregivers to look at those bony prominences and to let you know if there are concerns. The equipment you will be using at Craig Hospital is meant to keep you healthy and provide for safe and effective mobility out in the world. It is important that this equipment be used properly and correctly. Your occupational and physical therapists will be working with you to use them safely. Since there are so many pieces of equipment and each person will have individual needs, you will need to learn about your equipment, its use, its correct fit and function, and be able to troubleshoot any problems. Another major factor in skin health and the way to prevent skin breakdown is through attention to nutrition and eating habits. As your body heals, a balanced diet will help the mending process and keep your energy at its best. Protein is the major nutrient that assists the body in the repair of tissues and wounds and keeps your skin strong and resilient throughout lifetime. Human skin stays strong and heals using proteins in our diet. Protein is found in meats, cheeses, fish, yogurts, and beans. The Craig Hospital dietitians will assist you in making up meal plans and snacks to get more protein into your diet for healing. Once you leave Craig Hospital, continuing a regular balanced diet will assist in keeping your skin strong and healthy. Our body is about 70% water, so it makes sense to drink plenty of fluids throughout the day. Drinking water keeps our skin soft and pliable, making minor bumps and scrapes less damaging. Regular participation in daily exercise and activity will contribute to overall health, wellness, and well being, and quite possibly reduce the risk of pressure sores. Talk with your OT and PT about designing an exercise plan you can take home with you once discharged from Craig Hospital. Participation in community outings while at Craig Hospital is another way of exploring options for an active lifestyle following injury. Check out the monthly outing schedule in Therapeutic Recreation and sign up to go. While participating in exercise and activity, it is wise to practice good skin care. Wear sun protection, care for soft tissue through proper padding and cushions, and pay attention to blisters, scrapes, and bruising. People with a spinal cord injury have a lifelong risk for developing pressure sores. Sores are a serious problem that affects health and well-being in all aspects of life. Attempting to ignore the reality of skin sores will only make daily activities difficult and a little absurd. But ultimately, the responsibility and choices are yours. With daily monitoring and attention to prevention, many skin sores can be prevented. The earlier skin problems are found, the better they can be treated, and the faster you can get back to life.